Good late Friday evening, everyone. Sorry for the delay here. It is a little bit tricky getting in on late Friday night here and getting my internet to function, which I'm hoping it will remain stable through this process here. But tonight, as advertised, we're going to be talking about some of my graphs, some of walkthroughs of my graphs. That I've been putting up as the daily data, because we know they're going to be playing games with the numbers. We know they're going to be telling us horrible things are happening. And I want everybody to be able to look and see and understand exactly what kind of data manipulations they are doing and have that data at their fingertips. We also have some exciting video clips from our lovely press conference that happened on Wednesday from ODH. And also, Carrie brought on her friend Cassie, who has a really interesting story about, she had a survey at her school district about mask mandates and who is going to comply. So, Carrie, you want to introduce her further here?
So this is Cassie, and she is local. We're in a rural school district. And she had asked if she could put on the community page on social media just a poll. Who will comply if there's another mask mandate? And it was really interesting to see. She had so many no, like, no, we don't want this. No, this is done. And many that didn't even comment, that just clicked no. The few, which was under 20, that said yes, I looked them up one by one, and they either do not have children or grandchildren in the district, or they don't, that I could see, that was connected. Several didn't live in the district, and there were a few that did not even live in the state. So that to me gave, just a small indicator. It's just a snapshot of what those people in the area would like to see. Which is obviously no mask or no mask mandate. Again, that doesn't mean that you can't wear a mask. That is a choice. And nobody is attempting to take that choice away if you so choose. What they are looking for is a choice to put it on. And Cassie can explain that better, I'm sure.
Hello. So I posted a poll on the community page. I just kind of wanted to get a feel out of basically if I have to fight the school board, if I was going to have anybody backing me up. So I just simply posted who would support another masking policy for the school year. And I think there was 100 or so.
It was well over 100. I know it was posted on both, and I did not check the one, but there was 138 that commented no, they did not want that on the community page,
right.
Which is, there's a couple different ones. And then, but it was under 20 no's, and I was really interested in those no's. That's why I looked at those.
Yeah. So I just wanted to see, and I'm hoping that if the school district tries to pull something, because of course they're going to go by CDC guidance, the health department, or because the AAP came out recommending that the schools mask the children again. Then they had said something about division, like, are we going to mask the people who aren't vaccinated? Are we gonna, say, well, if you're vaccinated and over 12, you don't have to wear a mask? How's that going to work? Were we going to divide the classes at that point? So I just kind of wanted to get a feeler out, because the school districts last year made up their own rules as they went along anyhow. So.
And I don't know. I mean, I don't know if either one of you ended up watching the ODH press conference, the entire horrible thing. Yeah, so they were pretty explicit that they would be coming out. And I think actually there was a news article as well that they'll be coming out. I think the press conference said soon, and I believe the news article was saying Monday they're going to come out with their guidance. And from the press conference itself, it is pretty obvious what it's going to be. They specifically said, "Oh, we're considering," I think was the terminology they used, the AAP, what they came out with, and previous CDC guidance.
Which
So
is really
it's
interesting
going.
to me. That's really interesting because when you look at the AAP and then you look at the CDC, those two districts, or those two districts, I'm sorry, I was just reading Kara's comments, but those two guidances do not match. They actually contradict one another a lot. So it was interesting that some districts are choosing to go a little bit further and kind of bypass the CDC. So what happens when you have, this guidance there and you start cherry picking, I'm going to use this and I'm going to use that, we end up with mass confusion, and we also end up with the ability to break an infection barrier. So if it's truly about infection, then we need to go ahead and do all the things. And the most recent studies with masks that actually built on the 2011 study. The 2011 study looked at bacteria and masking, and how bacteria can get through it and how long it stays and so forth onto the masks. But they said in order for a mask to be effective, it doesn't need to be cloth. It needs to be a double ply medical grade mask, changed every 2 hours or any time that mode of entry is broken, and needs to provide eye protection in an environment that does not exceed 65 degrees. So my question is, who is paying for that? If we're going to do this, then let's do it correctly. Do I agree with it? Absolutely not. But to piecemeal it is not going to benefit any child, any adult, or anyone. So if it's truly about infection, then let's do it correctly. Let's put all the steps in place. And my thing is who's going to fund that? And what are the repercussions of doing that? We've already seen an increase in suicide, overdose, 101 horrible things. We're seeing segregation and discrimination happening, especially with those hearing impaired or those developmentally delayed. Um, so what's going to happen now if this is what we're going to do? Does that mean everything else again takes a back seat? And I know, that's a pretty sensitive topic for Cassie. But if you had to pick, Cassie, which one would you do?
I mean, if they absolutely have to be masked and I can't get anywhere, I'm going to keep my kids home. I mean, that's my one daughter had headaches every day after school. Every day. They all had breakouts of acne. I mean, just the look on their faces when they got home from being on the bus and when it started getting hot. I mean, I just can't do it. I just can't put them through that. So, I mean, if I 100% cannot say they're not going to wear a mask and they're going to make them,
So what happened when you did that at the end of the school year? Can you hear me, Cassie? Okay, can you hear me now? I think I'm having some technical issues. If somebody can't hear me, if they could comment, please let me know because I can't hear anything. So somebody had asked about the masking on the school bus, and we had talked about this briefly prior to. I don't even know how this happened. Um, again, CDC is not a regulatory agency. However, Cassie, they're saying that they can't hear you. So it must not be on my end. It's on yours. Check your uh, mic, Cassie. I don't think Cassie can hear me at all either. So, um, but anyways, as far as the masking guidelines, in February, there was a federal order signed. Keep in mind that the CDC is not a regulatory agency. It never has been since July 1st, 1946. And the CDC actually signed this federal mandate. And this federal mandate, it's for public transportation. So your planes, trains, and automobiles that are public. However, there's a special section that they included school buses, public school buses. And I'm not sure how that happened, that they were able to include public school buses, but they did. And when that was brought up at one of the meetings, then it was brought to the attention of Congress that the HHS had delegated that task to the ASPR, and the ASPR then delegated that task to the CDC, and the CDC signed it. Because there's nobody questioning it, then it will remain as stands until somebody that it directly affects. So it has to be a parent or a child or a school administrator has to say, hey, this should not be. Then they can rescind it. Now, does that mean that they'll probably just have another regulatory agency sign it? Probably. But if we start allowing agencies that are not allowed to do things to do them, we really start running a really fine line of what is okay.
The moment you allow them to take whatever power they want, they will take that power. I mean, it's a lot. Once you start something, it's hard to stop it. So however you mean to go on, you have to start it that way. I mean, I did this last year when the whole masking thing started. I just did not wear a mask. I walked in and said, "Nope, I'm not. I can't wear it." And from that moment on, it became incumbent on them to be the jerks because I had started without wearing the mask. And that's exactly what the game they're playing right now is. Well, they took the power of saying we can control local school buses. And since nobody said no, well, now we have to be the jerks and say, no, you don't have that right. And they can say, well, we've been doing it this whole time. So what's your problem now? The moment any of these kinds of actions are allowed to stand, and this is valid for what's most likely coming down on Monday as well, where the guidance, which essentially is close enough to a mandate, is almost certainly going to be unvaccinated people have to be masked, which means all 11 and unders need to be masked, and most likely they're going to recommend any adults who are in contact with those younger children have to wear masks as well. I mean, that's highly likely. And if parents stand for it, then that is going to be what is going to be this year.
And a separate but similar issue, we just today I found out Senator Rob Portman for Ohio, he had given the CDC praise because they had issued to the CDC, issued to Ohio Department of Health $31 million. Of that $31 million, Cassie, I can see you. Can you hear me now?
Yes.
Okay. Of that $31 million, 3.4 was going to Cleveland, or I'm sorry, Columbus. It's their city health department. But what was interesting to me was that the language that was used whenever he made this announcement, that he was extremely happy about it. And it said that the CDC had issued $31 million to the Ohio Department of Health for health disparities among populations at high risk and underserved, including racial, and ethnic minority populations and rural communities. Unfortunately, since the onset of the coronavirus pandemic, we've seen a large health disparities among different populations impacting the most minority of regions, such as rural areas, at a disproportionate rate. I'm thankful that the CDC has made funding available to Ohio to address these unacceptable disparities because every Ohioan deserves access to quality health services. We've made great strides in combating COVID-19, and as we emerge the pandemic, it is important that we don't leave the vulnerable communities such as the rural area behind. I don't
Yeah.
know about anybody else, but I read that and I was just shocked and floored because that's who's taken a hit the last 18 months. Yes, we have all been impacted. Every single Ohioan has been impacted some way, shape, or form. But the exact people that they're swearing they are protecting are the exact populations of people that have been negatively impacted to the point of death.
Yep. And
And
$31
our
million. That's not
$31 million. Yep. And that I think it,
OD.
yeah, going to ODH, which, and it says it's going to be a 2-year project, non-research grant to reduce COVID-19 related health disparities, improve and increase testing, contact tracing among populations at higher risk that are underserved, including racial and ethnic minority groups and people living in rural areas, improve state, local, U.S. territorial, and freely associated state health department capacity and services to prevent and control COVID-19 infection or transmission among these populations at a higher risk that are underserved. The City of Columbus Center for Public Health is receiving 3.4 million in addition to the 31 million.
So, do you guys have anything else you guys wanted to talk about at this beginning section? Because this is probably a really good time for, segueing into the ODH data to see.
Right, and I guess my thing, so whenever we, again, it was for a different topic that we were discussing, we were asking for. So again, I've said it 1,000 times. ALS, the state of Ohio has got the second highest amount of cases of ALS in the nation. So as a whole, we were asking for the ability to have access to phase 3 trial treatments for ALS. So when we had the ability to have access to treatments for COVID for free, where we didn't have to pay out of pocket, then those were not at phase 3 yet. And they've been pushed on us even. We didn't have to ask or beg. They've been every place that we look. ALS patients are begging for a treatment that has been in trial for greater than 10 years. And we have to pay out of pocket for that. So every ALS patient across the nation has to pay to have access to that if that is approved. And it would cost $1 million to put for every patient right now to get access to that treatment across the whole nation. And Rob Portman said no, he was not spending that, but he's very thankful that $31 million plus another 3.4 have come into the state for COVID. So to me, that is again just signaling one life is not as important as a COVID life. And so it was extremely frustrating. But if you'd like to continue with your data, you go ahead. Sorry. Thanks for attending my TED Talk.
No. I think it's. The only reason I want to segue there is just simply because $31 million to a institution that produces the stuff I'm about to show you. Yeah, as Kara said there, I saw that somebody needs to check my blood pressure because, that's wrong on many levels. These people are beyond incompetent, and I don't even know what kind of games they're playing, but they're nuts. So, without further ado, or you guys have anything else for this first section?
I don't, other than to say kudos to you, Cassie. And I really hope that you get some. I hope you're not standing alone fighting when it comes to the school district and the health department, because there is strength in numbers.
Right. I know that I read an article out of the Chronicle Telegram really quick that said that the Lorain County superintendents were supposed to meet today to come out with their plan. But then another article came out saying that certain local districts, like Amherst and Firelands, are making them optional. And
Yes,
social distancing will be optional. So there was nothing on Wellington yet. So I guess we'll just wait to see what they come up with. And then when the new guidance comes out, how that coincides with it. I did go on the website today, and as of right now, it says they will not be mandated, but that could all change. So we'll see.
it's right, and that's the thing. You have guidance. You're putting out guidance. Why are we treating it as the gospel? I did not know that guidance equaled gospel.
But even last year, with the guidance, they weren't supposed to wear them at recess. They were wearing them at recess. They weren't supposed to be wearing them at dim time. Had to wear them in dim time. My kids were forced to sneeze in their mask, and I mean, just like none of it made sense. And I mean, I fought the district over and over. I called the school. I'm like, why would you make someone sneeze in their mask? I mean, that is just absolutely disgusting. And they never followed the guidance. And when I called the health department, the local health department, they said that they're treated as their own entity. They can make up the rules as they go, and they did. So even with the guidance, these schools are saying, well, it's my rules, too bad. So as parents, we need to be prepared to say, no, I'm not signing those rules this year. No, that's not going to happen this year, because you give them an inch, they take a mile, point blank.
And
Absolutely.
we'll be having another Beyond the Data, I believe, most likely, hopefully Monday or Tuesday, that is very specifically focused on schools. And by that point, we'll probably have more knowledge about what DeWine has told us will be our lives for the next year, and what the fight is. So we'll definitely be talking about it, and maybe even ask you back on there, Cassie, so we can connect more people across the state, because strength in numbers, we've got to find the way to stop this madness.
Definitely.
All right, so data. So as many of you who are following me know, I do every day, I do daily data graphs, and they have been increasing in number of late. And I had the thought that I should probably take a little bit of time to kind of talk through exactly what you're seeing, because there's so many of them that I'm putting up there, and I don't have them all up there right now in my little list here. Some of them are a little more obvious, but just to
and
explain. Yep.
and with the inability that you've had the past couple of days to actually comment or explain anything, she's had to have carrier pigeons to
My
post and
carrier
do
pigeons
things.
have been a little bit slow at times,
Yeah,
a little, cross wires and things of that nature. But I really believe that this is something really critically important, also for dealing with schools, or dealing with any area of that we're going to be dealing with, that they are going to be ramping up cases, and they're going to use percentages. They're going to talk about all these horrible things that are going to happen, or are happening, where doubled and tripled and all of those things. But if people can come and look at these numbers and actually see the raw numbers and how they really break down, and how they're manipulating it in the media and that kind of thing, I think that's something powerful. It's something that you guys can take immediately and directly to whoever it is, whatever authority you're trying to do. And I want you to understand what each one of these graphs and charts are all about, and what kind of information you can get from each one of them. And anybody who has any suggestions for any of these things as well to make it more legible, more understandable, anything like that, by all means, drop it in the chat, send me a message, whatever. I want this to be clear and as usable as possible. So the first one is the first one that I've had. I don't know how long I've had this chart up here. I think it must have been March when Governor DeWine was saying that we would get our all the all of the orders removed when we hit 50 cases per 100,000, which of course he didn't follow through on that. We still have orders in place, and we are still completely under 50 cases per 100,000. And this one is, I think, rather important right now. That box in red right there, that is our total cases over 14 days. So that's probable and confirmed cases over 14 days. I actually should probably make the post again about why it matters that we're including both probable and confirmed, and that it is a 14-day time frame, which is beyond excessive, and what kind of difference that makes. But it's a big difference. Right now, we're at 45.9. Actually, that was yesterday's, because I haven't been able to do today's numbers yet. I'm sure we're higher than that today. I don't know if we've crossed 50 per 100,000 yet, but the odds are pretty high that by the end of the weekend, and conveniently enough on Monday, I'm pretty sure we'll be over 50 cases per 100,000 by Monday. Oops. So he'll be able to bring that issue up again about prevalence. So the other lines on here are breaking down the number of cases over either probable cases over 14 days, confirmed cases over 14 days, which is the excessively long period. And you can see that already probable cases are a third of the last 14 days cases. Now, probable cases include things like, mostly include positive antigen test results with or without symptoms or epidemiological links, which is absolutely against the manufacturer's instructions. It is against the FDA's warnings. They have quite a few warnings saying don't do this, and against the CDC guidance. This is not, you do not do this. You do not use antigen tests on people who do not have symptoms in areas with low prevalence. And that is exactly what we are doing. And that is the majority of our probable cases, meaning that our probable cases are pretty much entirely fictitious at this point. They're not real. These are not. They should not be considered as a full-on case. And that's already a third of our total. And then below the red box are ones that are only over 7 days, which is a more appropriate length of time to be counting these cases. Because COVID-19, the incubation period is a little bit longer than the flu. And what we count for the flu is over 5 days. So the CDC actually does, and correct me if I'm wrong here, Carrie, they look at it from a 7-day incubation period time frame. That's where they're counting their numbers on their website that I've seen most recently. Is that accurate?
It used to be, but since the ACIP meeting, we have switched it, because we now know, if anybody watched the congressional hearing from earlier in the week, and then the ACIP meeting yesterday, we've determined that we've been able to narrow it down, that in those with a normal functioning immune system, or a typically functioning immune system, an immune system within normal limit, whichever way you'd like to address it, the time from onset of illness to disease is 4 days. So the time from infected until you have symptoms is 4 days. So most of our tests say for antigen, the EUA specifies that as, and they will give a time frame. Most commonly, it's within 7 days. Some are 5, some are 10. Some say 5 to 7, some say 7 to 10. You just have to look at that EUA. But if it's for an antigen test, most of them say for individuals symptomatic whose symptoms have presented within the last 5 to 7 days, 7 days, or 7 to 10. Somebody said, how long have they known? 4 days, did they say? Um, Publicly, it was this week.
So just get just to translate that as well, to simplify that to the lowest level. When I'm even saying total cases over 7 days, that is excessive as basically
I
what we're
mean,
doing.
it's a good measure.
It's
We
not bad
have
to
right.
see
It's
changes.
7 days is not bad. Now, when we do our trajectories, those are done in 14 days because again, you're looking at two different measurements. You're looking at real time what's happening, which I'm going to tell you right now. The state of Ohio does not get information real time to the CDC. Yes, there's always a lag time with any state, but the state of Ohio is just insane. And they're not the only ones. But
$31 million.
right,
They deserve it.
right. And we can get into that more. I know that there was a comment from Jim where he asked for explanation of the Delta variant and how we test for variants and such. So we can get into that more then. Well, so Kathryn can do this, but when we're looking at trajectories, what we expect to see happen, yes, we do take that data for 14 days, which
But not
because
prevalence.
we're
Because that's
looking into the future. Prevalence, typically no. Typically, it's 7 days. There is discussion about changing it all to 14, um, but yeah, but at this time, I think that's so low on the list.
priority list.
Yeah, I mean, CDC is under fire, not just the ones that are up a little bit higher. They there was a FOIA request, and it was very evident that the school guidance was verbatim to what a very large teachers union asked for. And CDC adopted it as written, changed the guidance that was out for three days. Of course, they said, well, that was to accommodate those teachers that may be on immunosuppressant or receiving chemotherapy. Um, However, it was for the duration of that whole guidance. So that did not sit well. And it shouldn't, because there should be science-based guidance, not politically driven guidance of any organization.
Yeah, everything is politics. I think that's pretty
Yeah, and I have a hard time with that. If anyone has followed Kathryn for this last year, then I have said it till I'm blue in the face. And it's not COVID why I'm blue in the face, but it's just constantly saying it is healthcare and politics do not mix. And
no.
this is where we are because of that.
Politics and anything pretty much do not mix.
Right, that's
All
right.
right, moving on so we can get through this here. It's so much stuff, and it's really late on a Saturday or a Friday night. I don't even know what day it is. The last thing I wanted to point out in this particular chart here is at the top, these two boxes. I box out how many of the how many probable cases have been outed over the last 14 days and how many confirmed cases outed over the last 14 days. Now, these are important because actually I didn't even think to bring up my another one of the graphs I have or charts I have here looks at how many are reported in the last 24 hours. Sometimes we have some interesting things that go on where we have far more reported cases than we have cases assigned in the last 14 days. We had that a couple days ago where I think it was what was like 264 or something like that of the 700 cases, or 600, or it was 333 out of 660 cases actually occurred months and months ago, which makes a difference when they bring out that shock value. So that's what that top number is for the probables, and also when it comes to we've also had situations where we've had more cases reported in the last or assigned to the last 14 days than we've had reported in the last 24 hours. So you report, say, 100 cases, and there's 115 cases that had been added to the prior 14 days.
Yeah, so that's just some of the things that we go through for the state of Ohio. And again, I know this was asked a lot this week, and Kathryn couldn't answer it. Was Ohio does not, what is a case in Ohio may or may not be a case in either a different state or at the CDC. So there's a lot of back and forth paper shuffling that happens in order to determine what is a case. So the CDC numbers will never, ever, ever match what the state of Ohio has. It's not going to happen. Ohio is extremely inclusive. It actually hurts my heart to see that we are measuring any pandemic or any illness, for that matter, by case. We've never, ever, ever managed anything by case. We've managed it by hospitalization or death because we don't want to tax the healthcare systems. And of course, death is final. So that's how we measure a pandemic historically until COVID. We also would separate um, the surveillance, what we call, against the diagnostic. Those are two separate things. And obviously, we are not doing that here in Ohio. We clump everything together. So when that happens, then it just causes havoc once it gets to the CDC, because then we have to go through and see which boxes are checked to consider it a case at the CDC level. And a lot of times we don't have enough information. I know I received one that was just a fax. It was like a fax on a plain sheet of paper. Had it not been for the header at the top, the letterhead, we would have not even known what facility it came from. And it was just like 52-year-old female, C19 positive. I couldn't tell the date. I couldn't tell the physician's signature. There was nothing to tell me, was it symptomatic, asymptomatic, was it screening, was it diagnostic? Those are just some of the things that the state is seeing, like the facility sends it that way to the state. And if it doesn't stop there, a checks and balance system, then it gets passed on to the CDC. And after over a year into this should not be happening. We should not have had what we seen earlier in the week where Kathryn posted, hey, look, all of these are probable and they're assigned to older dates. And then once somebody in the media is tagged, then all of a sudden there's an announcement made by ODH that says, hey, JK, it was a system failure.
Technical issue.
Yeah, a technical issue of undisclosed origin, and then disclosed it. Had that not been brought to light, then that would not, and that system that ODH is operating in was paid for by our tax dollars. And we just got, that same agency just got $31 million.
So then that's the other thing where we're talking again about what you mentioned there about a lot of the cases don't count. When I talk about the probable cases, the vast majority of those probable cases are most likely not going to be counted by the CDC because most of them are going to be asymptomatic. They're going to be college students. They're going to be long-term care residents and workers. And that's, you can really see in the numbers that there's this odd little weekly kind of cycle, which is actually going right where I'm going here. So this graph I have not posted yet. And again, all of these graphs are from yesterday's data because I have not had the time to do today's. And this one I'll be adding probably to tomorrow's rounds of graphs. This is a graph showing and comparing what our case numbers were per day last year at this time versus this year at this time. I have several of these graphs like this, and I will add several more, I'm sure, showing 2020's trend in dotted line and 2021's trend in a solid line. So what you can see here, this is only going back to May 15th because May 15th is where I'm still collecting probable and confirmed data. So it was kind of a date that is kind of consistent across a lot of different ones of these graphs. So what you can already see here is that, they're making a really big deal about the number of cases, the number of new cases, and how they're spiking in the Delta variant, and we should all be really afraid because look at these terrifying numbers. Okay, well, if you look at what was going on in Ohio last year at this time, you can see our numbers are nothing to write home about right now compared to last year. There's another thing I'd like to really point out in last year's numbers as well. I've pointed this out a couple times in my posts, but I'm sure it gets missed. When you see those really sharp drops that happen every week, it should be a big red flag that something's going on here. We're not dealing with something. Something's going on besides a viral spread situation. Those drops are always on weekends, which is very interesting. Viruses don't care. They don't care when our weekends are. They don't care when our holidays are. You get sick when you get sick. So when you see those sharp drops, it kind of tells you that what you're seeing is an increase in testing, specifically asymptomatic testing. So last year, judging by the data, it looks like they were doing a significant amount of asymptomatic testing. While this year it's not been so bad, especially through the summer so far. It's been pretty good, actually. When you look at it kind of further back, you don't see really aggressive drops on the weekends. You do see the weekends. You can see where they are, but they're not really aggressive. Now, what's interesting is just in the last couple weeks, ever since July 4th, you can see that our weekends are getting deeper and deeper and deeper. And so keep your eyes on how deep those weekends go, because that will help give you an idea of actually what the real prevalence of actual symptomatic disease is. Any commentary there, Carrie? I don't know. You're like pondering there. Are we good?
We're good. Just keep on keeping on.
Keep on keeping on. All right. So here's one I've been actually posting for, I don't know, maybe at least a week, maybe two. This is comparing probable and confirmed cases assigned per day. So when the case was actually, when the person showed symptoms or when the test was taken, not when it was reported. And also, and those are the green lines, and inpatient and ICU bed usage per day. Those are the orange lines. Now, the dark orange line is the inpatient. The light orange line is the ICU beds, and the darker green line is the confirmed cases, and the lighter green line is probable. Now, what this graph is hopefully showing is showing what relationship there is between hospitalizations and cases. So when we see a rise in cases, do we see a similar rise in hospitalizations or not? And same with breaking it down by probable versus confirmed, because if we have a large increase in probable cases, does that also, translate into an increase in hospitalizations? And it gives you kind of this way to look at how those four things interact or don't interact. Because as we can see, the ICU bed usage is not going up as much as the inpatient bed usage. It is not going up as much as the cases are, either probable or confirmed. So
and keep in mind, that's why we started this and said we were going to use by cases, because it was novel and we did not want to tax the healthcare system. So give it 14 days so they could get their stuff in order, because they did not have the national stockpile or the state stockpile that they thought that they did. And then our first shipment was dry rotted and unable to be used. So just give them time to be able to purchase things without any bidding, and to make sure that our facilities were where they needed to be. And I believe our facilities are where they need to be. If not, I don't know what to say, because we're a year in.
Oh, wait for it. And you'll like my next graph here. Or not my next graph, a later graph.
Okay.
I don't even look at my graphs. Do you, Carrie?
I do look at your graphs, and then my eye twitches and I have to stop.
All right, so we're still mostly in this cases realm, but we're seeing how these probables are comparing to confirmed, and we are seeing more and more higher increase in probables than confirmed, and that also should make one go, I don't like this. This should ring alarm bells. So the next one that I want to focus on here is this one's a relatively new one, probably just the last few days when they had this technical issue where I finally figured out how to show what they have been doing this entire time. What they like to do is they just do stuff. They just change things. They change cases. They move cases around, and they add cases. They subtract cases, all the way back to January of last year, and they're doing this constantly. But happily, I finally figured out how to show this. I hope in a way that is a little more graspable to people, how they do this, where you see when they add a whole bunch of cases long ago. So that's what this graph is about. These are newly reported cases. So when they come and say, oh, there have been 785 new cases reported in the last 24 hours, I try to break it then down by how many of those newly reported cases are probable in the first place, and where are most of those cases being assigned? When did they actually occur? When did the symptoms happen, if they had symptoms, or when did the test happen? In this particular instance, the vast majority of the cases, this was yesterday, vast majority of the cases occurred 1 to 2 days before the CSV file came out, which is what we want to see. We want to see it close in. We want to see it really close to the now. Unfortunately, of course, a significant percentage of those were probable and will remain probable into the future. You can also see kind of in the middle here, oh, right, I have a pointer and I can actually use it. So you see this interesting cluster here. This is constantly happening in the CSV file. Something like this is happening. There's always something being added in the past. There's always being something subtracted. This little cluster here is ridiculous. I think this date right here had over 80 cases subtracted from it, and the day before had like 70 cases subtracted from it. I mean, it's nuts, and it happens every single day, and I have no idea what they're doing.
Kathryn, I just want to, I know we talked about probables real quick. I just saw a couple comments in there, and someone had said confirmed is with the PCR testing. Probable can be almost anything. Yes. And Kathryn had spoke to that earlier. That's correct. However, that confirmed with a PCR test, that does not mean that it is confirmed with a positive PCR test. For example, my daughter is a confirmed case of COVID, and she had a negative PCR test. So she is counted on the state dashboard as a confirmed case of COVID, but she is not counted as a confirmed case of COVID at the CDC. So it's correct that a lot of people, when they say, oh, it's confirmed with a PCR test, typically it is, unless you have other things happening. But so she's a negative, but she's a confirmed case of COVID.
The other thing about PCR tests to keep in mind, even though they're confirmed, we are not informed of each individual test's cycle threshold when it pops positive. So these people could be, these confirmed tests, cases, could also be including people who have a cycle threshold of 40 or 45, or it could be people who are 18. I mean, right. There's no distinction in the state of Ohio. So although they are confirmed, that does not mean that the person is infected or infectious, but at least it's a smidge better than probables, which are on all levels unacceptable.
Right. You don't have to have a test at all to be a probable, or you don't have to test positive. But that CT value, as Ohio is finding out, does make a difference when it comes to the variants, and sending those to the stat lab so that we can do genome sequencing, or they can see variants identification, which we can get into that later. And I'm sorry to
It
interrupt
might
you,
be a
Kathryn.
different day the way things are going.
Right, yeah,
But at least I won't have to load the videos or
right,
so at least that. All right, so the next one, hopefully that explains this particular graph in a way that people can grasp it, or if they have any more, questions or suggestions in a way that I can make this a little more accessible when it does come out. Because I'll do that one every day in case they pull something like they did a few days ago. And also, hey, if anybody can figure out what they're doing in the past, I'd love to know, because they do it every single.
yeah. I got nothing for that.
I don't understand it. It's constant. It's constant. And since and the other thing is I don't know if they're probable or confirmed that are being added and subtracted. I have no way of knowing unless somebody wants to every single day write down each of those numbers, which I do not recommend for your own sanity. But it is I don't know how else to get it, and I'm not going to use my time to do that. It's not worth it. So this one I also have had for probably a week or so now. This is a graph that is showing COVID positive inpatient and ICU bed usage per day. Again, comparing 2020 versus 2021. So the dotted line is showing us 2020, and the solid line is 2021. And oranges are inpatient, blue is ICU. So you should hopefully be able to see this kind of at a glance, how we're diverging from last year. They again are hyping this whole idea that hospitals are being overwhelmed and the cases are increasing and everybody panic and all this kind of stuff. And I should actually back up and say it's probably not even accurate to call these COVID positive patients, because we also know that Ohio has loose definitions as to who gets identified as being a COVID patient. They might not actually even test positive on entry to the hospital. And again, with your daughter, that was also a case. And I found, very similar instances in the CSV file where it's just like, well, that makes absolutely no sense for a person who had COVID in March of 2020 and then was hospitalized in June or July, that is a COVID hospitalization. That's pure nonsense, and it is happening. But that's how they do it. So these are identified as COVID, not necessarily even COVID positive.
Right. So words matter.
Words matter.
As I've, I think Kathryn for the past years like banged her head against, because I'm like, words matter. No, that's not what they said. That's not what the instruction is written. So we do like to point that out whenever we can. Like I said, my daughter, she was very ill, was not COVID positive, but was a COVID patient, was then subsequently injured several months later, which required surgery. And every time that she had surgery, it was marked, that was a COVID admission because she was a former COVID patient.
Identified as COVID. So that's who is being included in this. And even with that, even with over 1 million cases of COVID in the state of Ohio since the beginning of this, we're still at ridiculously low hospitalizations identified as COVID, however they want to identify it as. And compared to last year at this time, where we were at, I think it's over 1,000 there. It was, I think, about 1,100 in 2020 at this time. And right now, I believe we're around 380 or something of that nature, somewhere in that range. So they are talking about, our hospitalizations, our inpatient hospitalizations. And you can see on this graph that it looks like from around, July 7th or something, we have doubled our inpatient hospitalizations. But by saying we've doubled it, we've gone from 200 to maybe 400, while last year at this time, we were at about 1,100. And that matters. Now, I put this in, I think, yesterday's post, that I expect those two lines to come closer together, because last year at this time is when we peaked in our inpatients in the summer. This is the peak of the wave. While I don't know if we're near the peak of the wave now, so it might get a little bit closer, but I doubt that we're going to go anywhere remotely near last year's numbers, even with all of this crazy um, uh, counting that we do in the state of Ohio.
Right. There was one other. I'm just trying to grab the comments too that are associated, so I don't forget them. With what you're going through the graphs, but I just wanted to clarify that for my daughter in particular, it wasn't counting over and over, but because you're assigned a case number. So whenever you're determined a probable, possible, confirmed case, you get a case number. And then if you have an admission subsequent to that, you're still one case, but it now is associated with your case number. So you can have a hospital admission not pertaining to COVID at all, or symptoms like COVID, and it will still attach to that. So I don't want you to think that she was counted multiple times. I don't see that at all. I'm not saying it hasn't happened in the past, because we know, especially with deaths, because there was so many things being bottleneck at the beginning into one area, and then Ohio had an issue with several, like if a coroner reported it and the nursing home reported it, but one was on the electronic system and one was not, unless you manually go back through and validate those, then they were being double counted, or some were being missed. So they had to went back and do all of that to get a somewhat possibly decent number. And a lot of times those aren't caught until they actually get to the CDC. Um, and then they have to backtrack it.
To be fair, I mean, that was mostly in the deaths. I did
And that
not.
was death, yeah.
Yeah, I did not, when I would look at hospitalizations and cases, for the most part. I mean, I did find duplicates where it was obvious that doesn't make sense. I believe one of them was like a 20 to 29-year-old female in Franklin County who had onset and hospitalization at the exact same time, and having three individuals of that age with exactly same onset, exactly same admission to the hospital, very unlikely. But I did not find very much evidence at all that they were duplicating very many hospitalizations. So it
Right,
really,
yeah.
it looked to me like the cases, who knows, there's no way for me to tell if cases
Right.
are being duplicated or not. But cases that involved hospitalizations, they were not duplicating.
Right.
That I can say pretty comfortably that
Yeah.
I feel comfortable saying that.
And they shouldn't be, because there's a pretty decent streamlined system. Um, Even though it's not optimal, it's not one that I like, but that's just a personal thing. Um, for those, but the deaths was just, it was quite an issue for a while. So I just wanted to clear that up from that comment. I don't feel that she was counted multiple times. It was one case, but she had a hospital admission several months later that attached to that case. Carry on.
Carry on. All right, so now I'm going to move on to some graphs that I have of vaccinations. I mean, one of the vaccinations graphs, the pictures that I have, is nothing more than clipping the graphs from the state of Ohio itself about vaccinations. There's nothing really to see there, just simply putting it all in one place at the same time, which is nicer than the website, which, you know, has it all broken up and you have to drop down menu and all that kind of stuff. So there's not really much information on that one, so I'm just skipping it. What I wanted to show with this one, I've been doing now for a while, ever since the Vaxamillion, where Governor DeWine claimed that the increase in vaccine starts was because of the Vaxamillion, and that's actually demonstrably untrue. because I have that wonderful group of people who's been collecting this data for months and months. And if you want to do it too, there's plenty more to collect. So send me a message and I can hook you up with lots of data collecting. It's very fun. I'm sure they can all tell you just how thrilling it is. But because they did this, the website gives us information if you mouse over it or read it every day of how many of each age is vaccinated that day. And you can even select individual counties. But that information disappears every day and is replaced by something else, by the new numbers. And that's the only way we can get information about the age of people who get vaccinated, because the CSV file that you can download does not include age information. So because they collected all this data, I was able to pull this information out and show that dark blue line, which is 0 to 19-year-olds, that is the line, that is the group of people who had a massively increased number of new vaccinations. The rest of the age groups were almost entirely untouched. You can see the up and down, up and down. Again, this is like I described with the cases. Why do you see these sharp peaks and valleys? Because we're seeing weekends and weekdays, which makes sense for vaccinations, because you generally aren't going to go to a vaccine clinic on a weekend. I mean, maybe a little bit, but for the most part, you're during the week, whatever, that you get to a vaccine site, and so you'll see that weekly cycling, and that's not. And also, this is reported data, which is even more aggressively weekly cycling, and you can see that the giant peak is almost entirely kids, because they were able to, 12 to 15-year-olds were suddenly able to be vaccinated at the same time as the Vax-A-Million was announced. The other thing with this particular graph to keep looking at is just recently there's suddenly been an uptick in new vaccinations. And you can see, again, for the most part, the increase is in the 0 to 19-year-old crowd again. But there is also, it also does seem to be a genuine increase in some of the older age groups. I'll get to that in a moment here, but the increase in younger people is definitely real. I am thinking it has to do with the colleges all of a sudden mandating vaccination in order to exist on campus, because and they're doing it fast, where you have to decide within a week. We had a live with Dr. Kathy Stein earlier this week about what Case Western Reserve was doing, and it was in 8 days you have to submit proof of vaccination or start vaccination, or else you can't come to campus anymore. And then they just kept adding and piling on more and more restrictions and how miserable your life is going to be. And college kids being college kids, they're going to make their decision. It's not illogical for them to do that. And same with some of the older age groups for faculty and staff. But that's my guess there. So that's this particular graph. This is by day. So this is by day, and you can see it's really, really wiggly. It's kind of hard in this format to really compare things that are pretty close together. What's going on? I mean, data points that are close together or from week to week. So the other graph that I have that is exactly the same thing, except for I average it over an entire week, is this one. So these two show the exact same data. The only difference is each one of the points on this particular graph is total vaccine starts for a full week. So each point, you can see the peak on this one is looking like it's around, what, 55,000 or something. And if you look back here, in one day, it peaked out at about 14,000 or 13,700 or something like that. So this is adding things up so that we can get a better view without all that up and down, up and down, and up and down. And in this particular graph, you can really see here at the end this definite uptick in number of vaccines that are being started. I did post this in I think yesterday's post again, this commentary about this one as well, in terms of, yes, there's an uptick, but if we remain at this level, it will take us over a year to reach even 68% vaccinated. So although they're going to come out there saying, hey, we're so great, we increased vaccination rates, not enough. And these graphs are here to show you exactly how they compare with time. And although they might claim, look, we're going up, comparatively, we're really, really, really low. So that's the last thing I have to say about that one. And then here comes this one. I don't actually know if my carrier pigeons brought this to Facebook. Did you guys?
Carrier pigeons did. The carrier pigeons did their job.
Okay, thank you, carrier pigeons. I posted this on Twitter last night, late last night when I found it, because my head hurt. I don't understand it. I cannot even fathom how is this even possible. So this is very similar to the earlier graph that I had shown, and I will probably be making similar ones for deaths and hospitalizations per day, so expect to see those. This shows the same thing as I showed with the cases. That looks very similar. It compares one day's CSV file to the day before. It shows on which days and how many new vaccinations were either added or subtracted. And this particular one, I took off the most recent 2 days because that's where most of the vaccinations were. I mean, I think there were like 7,000. What do you want? Can you?
Did you say losing?
Let me finish up.
I just wanted to make sure I heard that right. And I'm echoing. Hold on. Did you say losing people by?
Yes.
No, I mean like subtracting vaccine starts.
Yes. So let me finish here. So I removed the last 2 days because they are like 3,000 on those last couple days reported, assigned to the last couple days, which makes sense. But if I had left those last couple days onto this graph, you wouldn't be able to see all this nonsense that's going on here. So I took those 2 away, and I'll probably continue to do that because those days are genuinely high and appropriately so. What I wanted to point out here is the craziness that's going on here. They reported these vaccinations, and they add them. So those last couple graphs that I'd been showing with the ages, those are reported. Those are not assigned because I don't have age with assigned date. So those are reported. But if you look at this particular graph, you can see that we have over here, they added vaccinations to last December.
That makes complete sense.
Okay, go on.
So those participants that participated in clinical trials. Now, when was the first day that Ohio received vaccines?
It would have been 12/14.
Right. But we had trials prior to that. They are reported on 2 separate, you have trial participants and where they're from and their ages and demographic information. And then you have like vaccine starts. They're starting to merge those together, which they've been very open with. They just kind of slide it in that conversation. So you're going to start to see those add in. However, one of the issues that's been presented in Ohio and other states is, so say CVS has got a call-in, or you have that central, I forget what the number is, but you can text something, and it'll tell you where the vaccines are, and you can actually sign up at a website, and it's supposed to all come together and work together and tell you what type of vaccines are available at each location. So unfortunately, there seems to be a time when the schedule. So it looks like we had 3,000 scheduled for today of number ones of, first starts and then second starts, but maybe only 1,500 showed up. So what should have been reported was the ones that actually received them. So we have three different things going on. We've got they're starting to import the vaccine um, trials of people that started like last summer.
Well, that's not
And
included in this data. This data only goes back to 12/14.
right,
Done. There's no,
but they're starting to do that now that they're unblinding, because if you're a resident of Ohio, you're a vaccinated resident of Ohio. As long as you're eligible, then that should be reflected. The other thing is we had a scheduled should have not been put in here at all. And then we had actually received. So we just have got to double check that everything, and I think that was part of the technical error earlier this week. And it wasn't just Ohio. There were
well,
several.
this is again. This is oh, well, so there was the technical error in cases. That's where they admitted it. This is vaccinations.
Right. But because that's going to affect our breakthrough, that affects a lot. So we need to make sure that it's accurate. Most certainly, we have a large amount. I know it's not as high as what Ohio would like to see, but there's a lot of vaccinated people. And I feel that anybody that has wanted it has probably made the arrangements to get it. The ones that are getting it now aren't so much of the ones that were hesitant or were unable to because of logistic reasons. It's more of the ones that they're like, I have to pay my bills, I have to eat, I have to finish school. They're going to get it now. But those who truly wanted it, they were lined up. They were getting a hold of Vax Queens. Vax Queens was a very big popular thing in Ohio, and they would actually find the vaccination for you. They would even make arrangements for transportation. Vax Queens were on it. Yeah. And they reached out through social media, and it was just a couple individuals that did that together, and that's fantastic. I think if you truly want it there and you can't get it because you're homebound or there's a logistic issue, I'm glad there's somebody out there to help those people. If somebody came to me and said, I'd really like to get this, we live in a large area that has a lot of Amish. If they came to me and said, I'd really like to get this, I don't have internet, can you help me? Of course, I'm going to do that. I'm not going to deny that just because it's not my personal opinion. So I'm glad that there's somebody out there to do that for them. But when you have things coming in from all over the place, this is the kind of thing that can happen. Plus, they're just behind in putting them in. Just like, I would tell you, when we got behind in putting in cases or hospitalizations or deaths and be like, hey, just let you know, this is happening, you can tell because you could see that dip and then you knew it was going to come back up. Like there's always a rebound, and same with this. So you're going to start to see them even in the next upcoming days. They're really going to start to be assigned.
Okay. But this is probably something else I'll be adding because they are going to use these reported numbers as what they're going to actually push here as whatever the new incentive is. I don't believe he's announced yet what the new incentive is, but I'm sure we'll find out soon. And they're going to probably, there's 571 of these that were added before July, and that's nothing to sneeze at. That's a significant number, especially of late when we've been having times where it was only about 2,000 reported per day.
And we really need to look at it would be interesting if we could have an event or be live during that time of it being announced, because I do feel that it's going to be an incentive that affects the state.
And on that note, thanks a lot, Carrie. Now we're all scratching our head going, what knowledge does she have? And left with
reading,
nothing.
no,
Hmm.
just reading the other states and what their next step incentives are. And DeWine has always one upped it. He always has. He was the first one out the gate with the 5 million, and others followed suit. He's going to one up it. And so if you look at kind of where his speeches or whatever you want to call those sermons, I don't even know. They kind of he tells. I mean, they don't hold anything back. None of them do. It's there. So,
Okay.
okay.
Well, unfortunately, we never made it to the ODH
That was my fault.
press conference, and I'll blame it on Carrie too because she's here.
Right. I'm here and I talk a lot. So that just happens. I'm disappointed because I know Jim really, hi Jim. I see you out there. I see all your comments. I know he really wanted to talk about variants, and that's like my niche. That's my arena. So
So,
someday we'll get to do that.
so that was what I was actually going to say right now. Maybe we end up doing Beyond the Data this weekend that is only about the ODH um, uh, press conference and specifically the Delta, because again, that's what they were talking about again. And happily, all the videos are uploaded, and so I don't have to delay with that. And I don't work on the weekends, so that also makes it a little bit easier in terms of that. So if those watching want to give a suggestion for a time over the weekend and we can make it, then let's see if we can find a reasonable time. Sound like a plan?
Yes, if they can do that, I'll try very hard. I will make it. I will make sure that I can be there.
All right.
Just let us know what time works, or let Kathryn know. Don't let me know because I'll probably forget anyway.
We'll probably let Lori know
Yeah, let
because
Lori. Lori is the
Lori's
person.
in
Lori Lasco,
control.
Kenna, and Danielle. They are definitely in charge of all the things. They're in charge of all the things.
All the things, even though we ruin everything.
We do. We do.
All right. Thank you everyone for joining us. And hopefully this weekend we'll finally get to those videos because man, that ODH presser was a doozy.
Yes.
So
And hi, Kara. Hi. Oh, we forgot Kara. Kara is the other one that keeps us straight. So hi, Kara. Thank you guys all. All right. Bye bye.
good night, everyone.